Hi, welcome to another video. Today we want to talk on something very crucial again. I'm sure you may have been enjoying our video in the past, and so please, when you watch the video, make sure you like it and then share to your friends. Okay? When you like it, next time we share video, you're gonna have it first. Today, I want to talk about hypertension. Hypertension. I'm sure you know that hypertension is a silent killer. A silent killer. A silent killer because the symptoms are not so pronounced. The symptoms of hypertension is always pronounced when it has been in the body for quite a long time. So when it starts, you may not know. But when it has been in your body for quite a long time, that is when you are going to know that you are suffering from hypertension. So today, let me show you some of the signs of hypertension. But before you begin to see these signs, your hypertension level must have gone to the level we call moderate hypertension. Because hypertension is categorized, it is known as mild hypertension, okay? Moderate hypertension, severe hypertension. Okay, so your own, before you begin to get the signs of or the symptoms of hypertension, it must have gotten to what we call moderate hypertension. But it's good to understand that you have hypertension when it is at the mild hypertension. That is a stage at which you can easily reverse hypertension. Even though medical science is telling you there is no cure. But I tell you, if you notice it on time, when it is mild is when it is between maybe 135, 140 and then 85 or 90 diastolic, systolic 145 or thereabout. If you notice it at that stage, you can easily reverse it, totally reverse it. So these are the symptoms. Number one, you begin to have blurred vision. When your BP level gets to what we call moderate hypertension, you begin to have blurred vision. Okay, you begin to have what we call double vision. You see like you are seeing two persons at a given time, and then you begin to have what we know as high-headedness. It looks like your head is very big, and then you have also what is known as fatigue. You feel so tired. Looks like you're going to sleep. Always looking like you are going to sleep. And then another time you feel like you're having headache. You'll be having constant headache, and that headache will lead to insomnia, lack of sleep. Okay, these are simply the fact that your nerves are contracting, and for that reason it's impacting on your head. It's giving you headache, it's making you not to sleep. Your nerves are not relaxed, that's why you cannot sleep. And then at another time you find out that you have palpitation. Your heart begins to pound, okay, or sometimes skip, as if there is a mechanical vibration. You see your heart begins to skip, boom, just like that. It looks like something, is happening, and your heart skips from time to time like that. And then another time you may have bleeding. But these signs or symptoms are not or may not occur to one person. There are people with peculiar symptoms, okay? So if this is not happening to you, do not say I've not had this one, but you may have any of these signs I have also explained. And then at a time, you may also have what we know as shortness of breath. Shortness of breath, okay? It's like your breath is going to cease. And then another time, you may have your heart paining you, excruciating pains in your heart. And then these times, this is a time for you to look for emergency or what we call medical attention. Now, when you have all these signs and symptoms, what does it call for? It calls for attention. You need to give attention to your body. I'm sure you know that hypertension leads to what we call stroke. Okay, so it is a worse condition if you get to stroke. So that is why you must avert it at this stage. Now, what may cause hypertension? In the last video, I talked about salt. Many people may not know that salt is dangerous to their health. Why? How does salt cause hypertension? Excess retention of water in your system helps your blood pressure to pump more. It increases blood pressure. Take note. When you take so much salt, it increases water retention in your body. And when there is excess water in your body, water you are supposed to urinate or supposed to go out, and it does not go out, anytime you eat, it's going to increase the pressure, what we call blood pressure, okay? Makes your heart to pump more. And when that happens, it's going to be dangerous to your health. That is how salt causes high blood pressure. And when that happens from time to time, it will cause your artery, okay, to shrink. And then it will also create what is known as atherosclerosis in your artery. That is the more reason you must reduce the intake of salt. So men, do something immediately in order to help yourself live a healthy life. Heart disease can be reversed if you adhere to health instruction. And this is a health instruction. My name is Itoro Paul, a dietitian, health and wellness coach, Chief Executive Officer of Diet and Health. Like this video and send it to your friend. Thank you.